Hi, welcome to our second live town hall update on COVID-19. I'm Libby Garvey, chair of the Arlington County Board. We held our first town hall last Friday, and we really appreciate the feedback that we've gotten from everyone. This week, we're changing our format just a little in response to that feedback, and I am joined today by my colleague, Christian Dorsey. And we have decided to focus each town hall on a specific area of concern. And although we'll certainly touch on other areas and welcome any questions that you've got about the current situation, from the questions we got last week and from what we're hearing from folks, we know that many people are concerned, especially about how our business community is going to survive this crisis. And we share those concerns. So today, we have with us several members of our county's very hardworking executive leadership team. We've got Mark Schwartz, our county manager, Jim Schwartz, our deputy county manager, and our featured guest for today, Telly Tucker, who is the director of our economic development office. So last week, we've been continuing to see our community come together and help those in need, provide support for our most vulnerable communities. It's just great to see. And people have also been getting better and better at staying the 6 feet apart and wearing some sort of face covering. I've got my little homemade one here. When you're out in the public to help stop the spread of the virus. And this is, at the moment, the most effective way we can slow the spread of the virus. And we need that everyone to be doing that to protect themselves and to protect our loved ones. But our numbers are increasing. Nevertheless, but I think not as quite a fast a rate as we've seen in some places yet, and I think that is totally due to what everybody is doing in our community. We need everyone to keep it up and even double down. So as we know, in the coming days, weeks, and months ahead, it's going to be a challenge for all of us. However, we here in Arlington are confident that together we're going to get through this difficult time, and we're going to be more connected and stronger than ever when we come out the other side. I want to thank everyone again for what you were doing about that, just to help make us get through this in the best way possible. So now I'm going to turn to my colleague, Christian Dorsey, to fill us in a little bit more. He's then going to introduce Telly Tucker to talk a little bit about our business community and the crisis. Christian and I will ask Telly a few questions, and then we're going to take questions from all of you. We plan to wrap up at about 12:45 or so. All right, Christian, you want to take it away?
Thank you, Libby, and good morning to everyone. Good afternoon, I guess. The Federal Coronavirus Task Force, as you well may know, has identified the Washington metropolitan region along with Baltimore and Philadelphia as upcoming hotspots for COVID-19 activity. And this assessment is consistent with our own, as we have over 6,300 cases at last count in the National Capital Region. And this is up substantially over the last 4 days, where those cases have grown about 67%. In Arlington, we've had an increase, though not quite as steep or as fast. But the important thing for us to recognize is that we are in the acceleration phase, as we mentioned last week, with COVID-19 in our community. And over the next week, we will see further acceleration in cases and, tragically, more deaths. As we look at hospital capacity, however, the Northern Virginia region is currently managing the demand. Around 1/3 of the beds and critical care equipment are in use, which means about 2/3 is not in use. So if we continue to rigorously follow the guidelines that have been directed for us to stay home whenever possible, and when we do have to engage in public, to rigorously practice social distancing, as well as tending to our personal hygiene, including using masks to reduce the spread of potential virus, then we can keep our medical services from being overwhelmed. So Arlington is doing a very good job. And as we've seen over the last week since our first town hall, there have just been so many ways in which our community has stepped up to help. We have had drop-off opportunities for critical supplies, PPE, personal protective equipment, which has provided some critical supplies for our medical professionals. And we've just seen people all throughout the county step up to meet the needs of those who are most vulnerable with food distributions, et cetera. So thank you, Arlington. And this is what we need to do in order to eventually get to the other side. Now, as Ms. Garvey mentioned, our focus today is going to be on businesses. And as we think about the impact on businesses, it's just been incredible, devastating, something that none of us have really ever seen before. And as a result, what we are concerned with is whether or not we are going to have the many vibrant businesses, whether they are nonprofit or for profit, available to meet the needs of providing goods and services when we eventually get through this. Now, fundamentally, this is a liquidity issue. All businesses, just like governments and individuals, their expenses remain, but unfortunately, their revenues have evaporated or all but evaporated in the most extreme cases. So this has produced a tremendous burden on many Arlington businesses. And joining us today to talk about Arlington's coordinated response to the unprecedented impacts on the business community is the director of our Department of Economic Development, Mr. Telly Tucker. Telly, welcome.
Thank you.
So generally, just to get us started, can you just tell us what has been the general effect that the pandemic is having on the Arlington business community?
Thank you, Mr. Dorsey. It's no secret the pandemic has been catastrophic, particularly for retailers, service industry, personal service businesses, not just here in Arlington, but nationwide. We've received more than 500 responses to a business survey we sent out. And while we're still analyzing that data, more than 70% of the respondents, particularly small businesses, have said this event is either very or extremely disruptive to their operations. As you know, Arlington is also home to a number of innovative tech companies. Quite a few of those have been able to continue their operations through teleworking. In some cases, they've used their innovation to pivot operations to help fellow Arlington businesses stay afloat. And so we want to say thank you to those businesses who are being innovative at this time.
Thank you so much, Telly. It's great to hear what other businesses are doing. I'm so impressed about how our business community is stepping up, including a lot of small restaurants and folks that have really pivoted to carry out. We get a lot of questions from people about how come some businesses can stay open and others of them have to close. Could you just talk a little bit about what that criteria is?
Sure. Thank you, Chair Garvey. Much of that decision, of course, is dependent on the governor's executive order and whether a business is classified as essential or non-essential. It really comes down to whether social distancing can be enforced in the workplace. Here in the county, we've been teleworking for the last few weeks. Quite a few of Arlington's businesses are doing the same. The businesses that get hit the hardest are those who depend on customer interaction, in-person interaction, literally people coming through the door. Things like retail shops, restaurants, hotels, that's where we're seeing the biggest impact. I will say we've seen a truly remarkable amount of resilience from our businesses. We've seen independent retailers switch to having an online store and others offering online classes as well. We've seen tech companies offer services for free help to school kids who are doing distance learning. And of course, the hotel and restaurant industry is really stepping up, not only doing things like restaurant curbside carryout, takeaway, delivery, but providing grocery services and meals to those in need and providing resources to our medical personnel.
Terrific. So as many people in the community are wanting to help and wanting to support local businesses that are struggling, what are some of the ways in which individuals can help support businesses that are in fact open? And what are some of the things that economic development has done to promote the notion that these businesses are available to provide goods and services to the community?
Sure. I would say that the best way to help is to patronize those local businesses that are able to remain open. Encourage yourselves and your neighbors, encourage to order takeout or delivery, purchase gift certificates for your favorite restaurants to use in the future when we're past this event. Shop online, of course. The stores that yours are the favorites of yours here in Arlington. On our economic development website, we have a full directory of all Arlington businesses that are open. ArlingtonEconomicDevelopment.com is the economic development website. And if you click on local business support, you'll see a listing of businesses that are open during this time. And you'll even see a listing of special deals that they're offering. If there are businesses that are not represented, you have the opportunity to click on the link and add your business name to that list. As well, if you are offering a special sale or some special service, you have the opportunity to input that and be added to the list as well. So I would encourage our viewers to share that news with any business owners. In fact, today, all day, our team in the police department came together for a social media campaign to encourage people to support local businesses. They're asking everyone to use the hashtag BizStrong, ARLVA, today to share how they're supporting Arlington businesses. This is just another way to help support our local business community.
That's great to hear. I like that, Biz Strong. That's great. So, of course, there are a lot of businesses that it doesn't work for them to be working virtually this way. How are we going to help them get through this? I know, we all read about federal money that's supposed to come, but I know from experience that money often doesn't come very quickly, and some people may not even qualify for it or know how to access those funds, and that helps. So could you talk a little bit about what we're doing now to help those businesses that are really, really struggling and can't find a way to continue to operate in the current situation?
Sure. There are a number of resources available, both through the Federal CARES Act legislation and through the Small Business Administration. Our staff is available to help any Arlington businesses navigate and apply for those resources. There's a team of SCORE counselors who we're working with as well, and the small business development centers in the region. We've put links to all of those resources and ways businesses can reach out to our staff on our website. Once again, that's ArlingtonEconomicDevelopment.com. And additionally, just last Friday, AED participated with the county manager in the proposal of a new framework for a new small business bridge grant that would be an emergency grant to provide up to $10,000 for eligible Arlington small businesses who have been negatively impacted by COVID-19. Stay tuned into Arlington Economic Development's website in the coming weeks as more information will be released on this new.
Thank you so much. That's helpful, and I know we're going to be seeing some of this in the in the budget coming up. So just get my camera working here. There we go. And I think, Mr. Dorsey, we're ready to take some questions from our participants, listeners, people tuning in, and if you could help moderate that would be just great.
You got it, Madam Chair. So we've had a number of questions that have come in. So why don't we start with what appears to be something that's on the minds of many people who are attending the chat. How are we doing on social distancing? People are concerned that when they go out in public, they see lots of crowds and they see many of those people not wearing masks. And the general question is whether or not we have any greater authority or power to enforce some of the social distancing guidelines that we have promoted. You want to take start at that, Ms. Garvey?
Well, I can, but I think I'll also turn it over to our manager. One of the frustrating things I think for those of us in local government here is that we have a lot of responsibility to help take care of folks, and we're really encouraging people to do what we know they need to do, but we have little authority to actually make people do it. And that's again why, we're really thanking everyone that does step up and are doing the, again, the face masks and all of that kind of stuff to try to increase the social distancing, but some people don't. So I think I'll ask either of the Mr. Schwartzers to talk about a little bit about what we can do and what we are doing and some of the limits that we have. And I would, Mark, do you want to start with that, or would it be better for Jim?
No, I'll start, and if Jim, you have anything to add, thank you, Madam Chair. We have been following the guidance that we've been receiving from the state on this. The governor is the one who has the majority of the power in this situation. So when it comes to social distancing, We've been encouraging people not to gather in more than groups of 10. We do have some police authority to try to limit that. There's, as of right now, we have not made any arrests. We're encouraging people voluntarily to keep their distance and not congregate in groups larger than 10. The other kinds of questions we've been getting is what kind of authority do we have, for example, when it comes to businesses like grocery stores, to require them to have their workers wear masks or cloth coverings. And the simple fact is we cannot force or require any business to have that requirement. So if you go to our webpage, at the very top, we're spending a lot of time really encouraging people and encouraging businesses to engage in good practices here. There's a video that we've put out with Captain Quigley from the police department that talks about how you should how you can use our parks and trails and keep your distance. The simple fact is that we need to rely on the individuals in our community to perform, their social responsibility, and rely on our business owners to follow through on our direction. But we cannot force them to do what, in this case, is clearly the right thing to do.
Thank you for that.
But if I can also add, there's clearly,
Yeah.
I'm sorry, Ms. Garvey, but as we remember that there are a number of legitimate reasons why people may be out and about. And what is critical is not that you don't see people out and about, it's what they're doing when they're there. And that's when we want to make sure that everyone is following the strong guidance on social distancing. And if you don't see someone with a mask, if they are maintaining their social distance, all is not lost. So we are going to keep up the drumbeat as to why this is all important. And I think we need to overstate that the issue of masks is very much to protect everyone else from you. The science says that it doesn't provide a whole lot of necessary benefit to you if you are asymptomatic, but if you are in fact a carrier, and unknowingly so, it can prevent you from spreading it when you are out and about.
Thank you. And for Mark, I'm sorry, I won't call you Mr. Schwartz because there are too many Mr. Schwartzes. Mark, I believe we are requiring our own workers to wear masks when they're out doing construction, and we are asking, and I don't know if we can require, I think we can, our contractors to have their employees do the same. And we do hear from folks sometimes about observing people not doing that who are working for the county, and we do appreciate them letting us know because I think we follow up. Would you like to talk about that a little bit?
Yes, that's an excellent question. Our staff, we have sent out guidance. We've had to do what a lot of people in the country have done, which is to try to follow the various changes in the Centers for Disease Control guidance. So all of our employees, we have made available to them, depending on their roles, either an N95 or a surgical mask or a cloth mask. And every employee who needs one has one, and have been told how to wear them and the requirements for doing so. So when it comes to our contractors, I'm not exactly sure the answer to that question. I assume that they're following that practice. And the best way to find out is I'm going to take a drive later today down to Columbia Pike and see how things are going. So that's our expectation. And if people see differently, they should let us know.
Thank you. I think that's great. It really is a matter of everybody helping out. I would like to suggest, so folks do write into us, and I don't take this badly, but tell it to the governor. I mean, I really think the governor needs to hear from what people want and think we should be doing. I think that's helpful. We are trying to get that message across about how important it is to be as strong as possible enforcing social distancing and the wearing of masks, et cetera. But again, we don't have the power to do that. Finally, I think people can vote with their feet. I have told people, in fact, if you go to a store and you get there and people are not wearing masks or gloves, particularly the employees, don't go in. If you feel like writing the store or mentioning to someone, you clearly are not, I don't feel safe in this facility, I'm not going to shop here. I think that will help encourage all of the stores to do what they need to be doing. But I think we can all play a role here. Don't be nasty or aggressive about it too much, but just tell them, I'm sorry, I don't feel safe. You don't seem to be practicing what needs to be done. So I'm not going to shop here until you are.
We're going to move on to some other questions. Similarly, people are concerned about construction activity, whether it be outdoor or indoor, and wondering a couple of things. What is our role in ensuring that those construction sites are safe, that there are adequate hand washing stations, hand sanitizer, and the use of PPE when necessary? But also, people are concerned as to whether we have the ability to control discretionary construction activity that may conflict with the huge numbers of people who are staying at home to work. So I think I can maybe start this answer because it's similar to the answer to the last question. We have limited ability to require that construction activity cease. What we can do is use all of our influence to prevail upon people who are engaging in construction activity to be mindful of people who are staying at home, and also to encourage the use of PPE extensively, as was just last discussed. I will share an interesting anecdote that I heard from some construction activity going on at a site that has a number of union workers present. Because of the power, if you will, of a union, they've been able to ensure that the use of PPE is mandated, part of the daily safety regime, as well as adequate hand sanitizing stations. So we do see, at least on some construction sites, that there's a real commitment to doing that very thing. Anyone else have anything to add? All right, moving on. An interesting question about public libraries. Someone is concerned that our libraries don't have an ebook collection that's sufficient to the needs, particularly for children. And is there any way to keep the libraries open in a way that allows for proper social distancing, given the fact that schools are not open and libraries are a key way to keep continuity and learning?
So why don't I try that? We have seen an explosive growth in the number of people who are using our ebook collection. And right now, the limitation is a matter of funding. And so that is one of the things that we will have a conversation with members of the board as we go through. I proposed a budget right now for the moment. It includes some small amounts of increase for the library budget, around, I would say somewhere around $50,000 for additional resources. And we will continue to have that conversation. The budget I proposed is based on the assumption that we're going to be losing an enormous amount of revenue, but we still have set aside some contingency funds to see whether we want to add resources for the library. I think if we did, that resource would be well used by the community.
Thank you, Mr. Schwartz. And we've had a number of people asking questions about renters and the issues that many renters are experiencing. It was reported nationally that 70% of people didn't pay rent on time on April 1st. There are a lot of things that are happening for mortgage holders to provide them some flexibility. What is happening for people who are renting? So I'll start this, and please, anybody who wants to jump in, feel free to continue. In the middle of last month, well before we got to April 1st, Arlington County and the board chair, Libby Garvey, authored a letter to everyone in Arlington, asking them to provide flexibility for people in meeting their rent obligations for April and for as many months as we are under stay-at-home orders and people are experiencing reduced income. There's also been a temporary stay, at least through the end of this month, on evictions that has been ordered by the governor and will be enforced by the courts. So there's that level of rent protection. We do not have the ability to require that rents that are in arrears are renegotiated, but we have encouraged that flexibility on the part of property owners and do hope, in fact, that they work with their tenants. Anyone else have anything to add there?
I will a little bit. I think there is a number to call, and I realize I'll ask Mark to comment when I finish. I think it's the 7999 number if they've got issues. We're very aware of this. Last night we held a meeting. I was talking with a number of folks with some staff with us because the meeting was basically entirely in Spanish. Some folks talking to us about how they've got two children at home, and both the mom and the dad are out of work now, and they are so worried about the rent. Their landlords are, at least the landlords they were using, have let them know they can delay the rent some, but of course they're worried they're going through their savings, and what are they going to do when they come out the other end and there's such a large amount of debt. We're very, very aware of this and committed to trying to help people. The last thing we want in a pandemic is people out on the street. We don't want that anyway. So I think we're very committed to it, and I really appreciated the staff. We went for about an hour and a half late in the evening in Spanish, talking about all of the supports we've got for our most vulnerable. I think the whole theme, Mr. Dorsey, you and I both have had focused on equity in our chairmanships, and it's really clear how crucial that is, and that we take care of everybody because all of our health depends on it. I know, Mr. Mark Schwartz, you're going to,
Right.
Your budget that you presented focuses on this as well. One of the few things we're really going to increase our funding on moving forward, and I'll invite you to talk about that a little bit. Again, I'm sorry, I'm worried that I didn't give out the right number, but there is a phone number to call, and maybe you could talk about the flyers we're about to put out as well.
Right. So we are about to send out flyers. The correct number, if anybody has a question about housing and food assistance, that includes rent, expenses, eviction prevention, any assistance, is 703-228-1300. And that is going to be included on a flyer that we have produced. And I don't know if it's up on our website yet, but we're in the process of posting it, and it will provide information. The main number, if you have questions on COVID, is 703-228-7999. But the food and assistance, which are really the most important and essential needs for our community, can be handled by calling that 1300 number. And we're going to be posting a lot of the information on that, and also what are the rights of people who are renters. And we've gotten a lot of questions about that. Post that as in many places as possible, so people know what it is they can do and what they can't do. As of right now, the most important thing to realize is that the Supreme Court of Virginia has suspended all evictions until April 26th. And so that is, you cannot be told to leave where you are. And we're hoping that date gets extended, but there's a lot more information on our website and the frequently asked questions section on renter rights.
Thank you.
Thank you all. A number of questions about food delivery. We touched on briefly our Cooperative for a Hunger-Free Arlington efforts, but more specifically about the lack of delivery slots that are available from a lot of stores and not able to meet people's needs. And is there anything that we as a county can do to better ensure that there is the delivery of particularly food to people who have the ability to pay?
That's an excellent
I'll start us
question.
off, Ms. Garvey.
Yeah,
okay?
I think I'll give a little advertisement for next week's meeting. Next week's town hall, we're going to focus. We'll have Abby Raphael here as our guest. She is the co-chair of, and let's see, it's called Cooperative for a Hunger-Free Arlington, and that does include everybody. And there, she with Diane Kresh, our head of library services, are just doing yeoman's duty, pulling together every kind of resource we've got and looking at the whole county in a holistic way to make sure that everybody who needs food can get it, including people who have the money to pay but are having trouble accessing it. So appreciate that question. It's a huge issue. I will say today we were trying to figure out what's the most important thing to talk about, and that's clearly at the top of our list. We're giving them a little more time to set it up so she can talk a little bit more definitely about what we are doing. And I think Mr. Mark Schwartz probably has the most up-to-date information on where we are on that as well.
Well, I'm going to turn it over to my cousin from another mother, Mr. Jim Schwartz, to update us on that.
So thank you, Mr. Schwartz and Madam Chair. So as you've already alluded to, the Cooperative for a Hunger-Free Arlington is ramping up. And the idea behind this is that there are so many good things going on in this community right now to serve people who have food needs, either because they are families from our school system that get free and reduced lunch on a normal basis, and now have to have that continued in the absence of actual schools. We have PTAs that are starting up food drives, and of course we have the wonderful resource in Arlington, AFAC, the Arlington Food Assistance Center, that is ramping up with a lot of volunteer support. And the idea here is that as things grow under this cooperative initiative, we're going to be looking to identify where the gaps are, where people may not be getting access to food. What we're very concerned about in the coming weeks is that people who have the resources won't have the mobility because they may become ill themselves. So one of the things that this new effort is going to be promoting is for everybody to identify perhaps a neighbor, a friend, somebody that can be, I think we're calling it a preparedness buddy, somebody that if you fall ill and are unable to access some of your essential needs, you can call on that person to perhaps get them and provide them for you. But in the absence of that at an individual level, this new initiative is going to be looking to identify people that don't have access, and then using an army of volunteers as well as some of our nonprofit organizations in the county to provide those services as a backstop.
Okay, thank you. Several questions about multifamily buildings and how we are communicating with the property managers of multifamily buildings about how to keep those vertical communities safe and sanitized so that people who may be sick with coronavirus don't spread it within those communities, as well as what are we doing to encourage or provide access to the recreational outdoors for people in multifamily buildings. I'll start us off. Clearly one of the reasons why Arlington's trails remain open, because we have many people who don't have property of their own with which to enjoy the outdoors or to recreate. So our trails are open for all residents of the county, provided people practice good, safe social distancing. That's one of the essential reasons why our trails remain open for public use, and provide the ability for people who may not necessarily have space of their own to recreate outdoors. And we have a number of resources which we have provided directly to property managers of multifamily buildings, as well as the association that works with multifamily buildings on how to keep those communities safe in the event of coronavirus infections within that community, as well as the general safety practices for keeping things disinfected and controlling any possible spread as much as possible. Anyone else want to add anything? Other questions concern similar multifamily buildings, assisted living communities. What is the status of whether or not people can be admitted to assisted living communities? And are there any other special directives that Arlington County is implementing to deal with that very vulnerable population? And I think Mr. Mark Schwartz, you should tee us off there, because there's been a lot on that recently.
Right. Thank you, Mr. Dorsey. When it comes to our nursing homes and assisted living facilities, we have given a lot of attention to that, and by reading the national media that a coronavirus case in a facility like that tends to be treated very seriously because of its potential impact. We have been working very closely with all the nursing homes and assisted living care facilities in the county. As a matter of fact, our public health director, Dr. Ruben Varghese, just a few days ago sent out a very detailed, about 70-page set of guidance to those facilities. We, as far as I know, they're still admitting people into those facilities. We have worked very closely to make sure every worker in those facilities and whatever staff needs the personal protective equipment, we provided ample supplies to them from our stock. We also, as of actually today, the Virginia Hospital Center, which continues to do its testing down at the Quincy Street property, is now today, and I don't remember which of the facilities they're going to, has stood up a mobile testing ability, and they're going into those I think one of the nursing facilities today and following it up with more, and we'll be doing testing there. So a lot more going on there. And I'm going to ask Jim if you have anything else to add, if I've missed anything.
Mark, I think you pretty well covered it. The only thing that I would add is that those facilities are taking strict steps when they do have somebody that is tested positive to isolate them from the rest of that community. Obviously, it can be a difficult situation because everybody is in one facility, but those facilities work aggressively to isolate anybody that is tested positive.
There's another question about the relationship between the models and our planning, and what are we doing to ensure that we have sufficient capacity within the region when it comes to beds, ventilators, and other equipment. As we mentioned at the start of this, currently the current status is that there is good capacity on all of those levels in the Northern Virginia region. And even with expected increases, as long as we do our part, we expect that we should be able to manage the availability of those key commodities within the medical services community for people who truly need them. I'm going to turn this over to Jim Schwartz in just a moment, since he is our point person on liaising with hospitals in the region. But one of the things that we should all remember are that models change all the time based on data that changes all the time. And one of the key indicators in a model's level of accuracy is the extent of the rigorous social distancing and hygiene that goes on in a community. So one of the ways in which we all impact the outcome of any model that you've ever heard of is by doing the things that we have asked you to do. Mr. Schwartz.
Thank you, Mr. Dorsey. As we've spoken about before, what you just mentioned is all about realizing success in what's come to be called flattening the curve. The idea here that if we don't practice social distancing, if we're not wearing face coverings where appropriate, then the healthcare system can become overwhelmed. Despite the fact that we are working hard to flatten the curve, as you also alluded to, both Virginia Hospital Center and all of the hospitals in the Northern Virginia area, I think I could probably say this is true across the National Capital Region, have substantial surge plans where they are able to accommodate more patients than their daily licensed bed capacities typically allow by a fairly substantial margin. In the region, our hospitals have figured out how to surge to 76% beyond their normal daily capacity. So that is a substantial additional capacity that our hospitals have planned for. In addition to that, some listeners may recall that about a week ago, the governor announced that there were going to be a couple of alternative care centers that were stood up. He announced in the Northern Virginia area that the Dulles Expo Center would be a facility that would be an alternative care site. And this is a site that is being planned should the capacities in that 76% that I just mentioned, should we go beyond that. The details of how that facility will actually be used, in other words, will it be for an acute care patients, those that do not need intensive care but still need care beyond what they're capable of receiving in their home, or would it be an overflow for intensive care, has not yet been decided. I think what I would add to this conversation for those in the community that are listening is that if we get to the point where we are going to have to rely on an alternative care center, we are going to need more medical professionals. One of the real gems that we have in Arlington and actually all the jurisdictions around Northern Virginia is a medical reserve corps. These are healthcare professionals that volunteer their time to augment our public health system, and we've been using them since January. But if an alternative care center is actually stood up, we are going to need more medical professionals. And if there are those out there in the community that fit that profession and want to volunteer their time, they can contact our public health division. the Arlington County Public Health Division and ask about Medical Reserve Corps. We also have information online about that, and that'll be a way for us to perhaps build those resources that are going to be so vital if we do in fact go beyond what the surge capacity capabilities of our hospitals already have built for.
Mr. Dorsey, I'd like to talk just a little bit as we all know, actually, how important regional cooperation is, and just let folks know a couple of things. One of the reasons that we're in a relatively good position right now is that this region has been prepared for some sort of emergency for a long time. So we've had a supply of PPE and masks in place, kind of waiting for something like this. It, of course, was anticipating to get us through a period of time and then get help from elsewhere. I don't know that anybody quite figured out we'd have something as serious as this that everybody would be dealing with. That said, it does go in ways as to who's dealing with the surge at any given time. And I know, Mr. Dorsey, you're on the Council of Governments, and I know at COG there are conversations that go on, not only for Virginia, but also with the district and Maryland, so that as a region, we're trying to look at who needs what and how's everybody doing and can we coordinate. And I know Mr. Jim Schwartz, actually Mr. Mark Schwartz, both the Schwartzes are spending a lot of time with their counterparts in the region and particularly in Virginia. I am on a call twice a week with my counterparts, the mayors and chairs, going over how we are doing. And one thing to stress that people need to understand is that even if we're doing great here in Arlington, we are affected by everybody else around us. In other words, we're really not going to be much healthier than the sickest area that's in our immediate vicinity or in Virginia. And so there is a lot of regional cooperation that needs to happen, and we are working hard on that. A lot of time is spent on that. Just like to let people know that that's happening. But it is a bit of a work in progress because none of us have ever faced this before. So we're getting a lot of support, particularly from our congressional, at the federal level, and talking to people at the state level and trying to bring it all together because obviously right here in Arlington for us is where it happens. But there is a lot of that coordination going on. Thanks.
Okay, thank you. We are going to continue on past our 12:45 time. I think everyone is able to do so. We've got a lot of questions to get to. I'm going to challenge us all to try and be a little bit more succinct, even though we're conveying great information. For Mr. Tucker, a few questions regarding the availability of businesses to operate during this challenging time. So someone notes that a toy store is providing curbside pickup for orders from its place of business. Is this something that the county is helping facilitate and encouraging other entities that are not essential to allow them to continue to provide services and maybe employ people at the same time?
Thank you for that, Mr. Dorsey. The question. The county has not been involved specifically with facilitating non-essential businesses outside of restaurants. What we have continually directed businesses is back to the governor's executive order, which refers to social distancing and obviously businesses that are incapable of maintaining 10 or fewer patrons in their place of business. They should shut their doors. We do have some businesses that are able to maintain that 10-person limit and provide things like curbside pickup, such as the restaurants have as well. But we have referred everyone back to the language in the governor's executive order on that.
Thank you. But generally speaking, it's safe to say that we're seeing a lot of creativity from businesses in our community to continue to meet needs despite the directives that have been imposed.
Yes, sir.
All right. And so similarly, there's a question, can a business be open for orders online while providing curbside pickup? And the answer is generally yes. If that's something that the business is equipped to do and able to do, it can certainly employ that business model to operate.
Yes, I would be sure to highlight, Mr. Dorsey, that there is a specific list of businesses outlined in the governor's executive order that are explicitly stated those types of businesses need to close. But then there's also a catch-all for any other business that's not named, any other industry that's not named specifically, fall into kind of an other category. So I would direct any businesses to that Executive Order 53, I believe it is.
Thank you very much. Ms. Garvey, next question is for you. What has been the biggest challenge that is the board has been confronted with during this time?
Oh my. I think it's having to move as quickly as we need to respond to this crisis and to support our staff in doing what they need to do. And also staying in touch with everybody. Communications is also always a crucial part of what we do. And I'm finding that today more than ever, that communications and connections with people is more important than ever, which we're doing here. We hear from people about concerns about construction crews not wearing masks. We're hearing about people who need food and can't get it. We need, all of that information is crucial for us. It's coming in very quickly, and we're working hard to adapt as quickly as we can to get it all into a structure that we can manage it and respond well to. I want to give a huge shout out to our staff, everybody who's here on this call. There are folks who are seen and unseen who are working flat out really hard to make it happen. We're working as hard as we can. Sometimes it's a little hard when people don't quite understand some of the challenges that we're facing. But generally, when it's explained to them, they realize that there's some really major priorities here that we've got to focus on, and there's some things that we might not respond to quite as completely as we used to when we weren't worrying about feeding people and keeping them safe from a virus.
Thank you.
Yeah, and Mr. Dorsey, I would invite you to answer the question as well. You're my colleague. We're facing the same thing.
Well, I would agree. Losing the ability to connect with people in the traditional ways has forced us to innovate on the fly, as with efforts such as this. But it also means that it's been a lot more difficult to ensure that the essential information people need is conveyed with all of the motion and impact that face-to-face live communication can convey. So while we have lots of great information out there, we lose the ability to really provide people with the navigation tools to know what is really the most essential thing for them. So we're trying to figure it out, and we're getting there. Another challenge has certainly been something that is also the subject of another question this week, the vacancy that is going to occur on the board due to the resignation of Vice Chair Eric Gutschall. It's certainly something that has been a tremendous challenge for me and all of the other members of the board personally, emotionally. And the question concerns what is going to happen with the vacated seat. I guess I'll start us off here. So while on Facebook, Mr. Gutschall announced that he would be resigning his seat, that is not going to be effective until next month. And then from there is a legal process that is prescribed for when a special election must take place, and that is up to the circuit court. If I am correct, there's a fair amount of discretion, I believe, that they have, and I may be speaking outside of my area of expertise here in determining when exactly that special election would occur, but that will all be determined at some subsequent time nearby, and it will be shared with the Arlington community widely.
Thank you. I'd just like to add that brings up another sort of a major issue we're finding is that, we function within this is a legal society that's important. We have freedom of information requirements, we have meeting requirements, we have election requirements. Most of that Virginia code and requirements were put in place at a time before we had technology and no one anticipated a pandemic. So consequently, we are coming up with things that we're capable of doing in a much more efficient and effective way that we think will work better. And we're finding the code as written, we can't do it that way. So again, as I think I touched on a little bit earlier, one of the difficulties for us, I think at the local level, is the amount of responsibility we have, and that we're not always, we don't always have the authority to actually do what we see very clearly we need to do in as effective a way as we can. So we have to figure out workarounds, which is sometimes why things are a little bit clunky, but we're figuring it out and putting pressure on our legislators and our governor at times to please make some changes in the code, at least for this emergency, so that we can operate as effectively as possible during this pandemic. Thank you.
Thank you. Mr. Tucker, so there are questions about whether or not you, from your position, look at June 10th, excuse me, as being the right duration for when we should be under these stay-at-home orders. Do you think that there is a way, a reason, a necessity to have us get back to normal a little bit earlier than that? And what's your relationship with the powers that be in Richmond to determine whether that date remains the same or is changed either earlier or later? I'm including a bunch of different questions into that one. So,
Sure. I wish I had a crystal ball to determine when we could definitively give businesses a date on when they will be able to reopen. Fortunately and unfortunately, that decision does not rest within my area of expertise or responsibility, but we do have weekly communications with a team of state officials, the Virginia Economic Development Partnership, Stephen Murray, who leads that organization, as well as one of our George Mason Small Business Development Center colleagues, the Virginia Economic Development Association, which they all represent the voice of business at the state level. And they have direct conversations weekly with the governor's office about when businesses will be able to reopen. And so I think much of that depends on how well we continue to socially distance and flatten the curve, has been stated earlier during today's call. And I think it remains to be seen. And so we've urged people to be patient, because we believe that everyone's health is our primary concern, but that we hear your concerns that businesses need to be able to open as soon as it's safely possible.
okay, we'll move to Mr. Jim Schwartz for the next question. How will we know when we have defeated the virus? When will we know that we have reached it? What is the decision point for knowing that we are able to move on to a different stage in responding to the pandemic?
I don't know that so far there has been a specific definitive measurement, so to speak, that we will know when we are out of it. If you listen to Dr. Anthony Fauci, he's talked about a steep decline in new cases. So that, looking at the data, looking at certainly, something that would give people in his business, people with his level of expertise, a sense that we have not just hit a peak, but that we have substantially fallen off, and that some of the things that we are practicing right now, like the social distancing and such, we could start to diminish the ask of our community. So I don't know that we have a specific measurement as yet. It really, I think, is going to come to the judgment of people like Dr. Fauci, the Centers for Disease Control, and other public health officials.
Thank you. And similarly, someone is interested in understanding whether we are anywhere near flattening the curve, and do we need to do more? So I will allow you to continue, Mr. Schwartz.
Yeah, I would just say that our numbers in Arlington continue to climb. We've been so far fortunate in the numbers of people that have tested positive, and I would say even the people that out of those that have required hospitalization. What Dr. Varghese keeps reminding us is that the population of Arlington is relatively small, and so the numbers that we are seeing are not necessarily indicative of the full picture, and that's why the numbers that we are also looking at are those in the National Capital Region. Those also continue to climb. So we've not seen any, we certainly haven't seen the peak yet, and we haven't seen any reduction in the percentage of people testing positive.
But we should not take those growing numbers to mean that social distancing and our efforts are not working. The numbers that we see on a daily basis are reflective of prior activity. It's a lagging indicator. This is absolutely what is the consensus understanding from epidemiologists. The way we get to flattening our curve are rigorously doing the things that we have been doing already, finding ways to even do them better. And, so please don't take the fact that the curve is not flattening and the data that we're talking about right now as being evidence of failure. In fact, we know that we're on the right path to doing what needs to be done.
No, exactly. People who test positive today may have actually acquired the virus as long as 2 weeks ago. And so you're exactly right. It's a lagging indicator, and we just need to keep pressing on these best practices.
Okay,
I
for
had
maybe
a quick question.
Go
I
ahead,
had a
Libby.
question for Mr. Schwartz, for Jim, just on the issue about they may have acquired the virus as much as 2 weeks ago. I would think if people, I think it's a 14-day incubation period, and then sometimes people get a little bit sick and they don't come in for a while. So it seems to me it might be even a lag of 3 weeks before people actually are sick enough that they start to worry. Is that true or not? Am I understanding that?
Well, it certainly could be, Madam Chair, because remember, we do know that people can possess the virus, have the virus before they show symptoms. And under the testing protocols that we have today, people are typically not getting access to testing unless they are symptomatic. So I would agree with you that it could be a little bit longer than 2 weeks.
Thank you. And I think it's important to stress that because we've done so much. 2 weeks is a long time for all the things we've been doing, and people start thinking, it's not making a difference. Well, it's going to take a while. So please don't get discouraged. We all need to keep it up and even double down. Thanks.
Thank you. Okay, we get a lot of questions about how to integrate social distancing into everyday life and some observations and concerns. So I'm going to throw out a bunch of things and give Mark Schwartz the first opportunity to sort of respond from your perspective of implementing rules in the county. So there is the gubernatorial declaration that outdoor spaces such as golf courses can remain open, yet Arlington has closed outdoor parks. We also have far fewer traffic on our streets. Is there anything that we can do to open up streets so that we don't produce crowding on sidewalks and trails as people try to find places where they can lawfully recreate? And what makes facilities like a tennis court inherently unsafe for social distancing purposes? Take it away, Mr. Schwartz.
Well, thank you, Mr. Dorsey. What I'm going to do is focus on your first question about outdoor parks and the incongruity I think several people have noticed, which is that if golf courses are allowed to stay open and our parks are not. So I am not a golfer. I do know that the ability to keep distances on a golf course may be a lot easier to do because there are fewer people there and that they can stay further apart because those golf courses tend to take up big areas. Our parks are wonderful. They're used very much by our residents. The difficulty in making sure that people don't congregate and don't use, sort of the play equipment. It essentially became too much for us to police on our own. And so what we've done is we put up signs discouraging people from using parks and actually making it clear that they can't. The question on tennis courts is something that you had lobbed my way, I think, during the last town hall. We had a conversation about that, and I think that to my mind, it actually may make sense to allow people to play tennis, but this is one of the situations where we're drawing a bright line so that people don't expect that one thing is okay in a park space and another thing isn't. So we're being pretty fastidious about the rules we apply there. The other question about outdoor usage, and we received this question from multiple people, which is that given the reduction in traffic, the question is posed more generally is why don't we make some of the parking lanes and other spaces along our streets generally available for people to walk? And the short answer is that there's a case actually where we've worked closely with the owner of Trader Joe's in Clarendon to make that those parking spaces available. But as a matter of course, and I think you'll see this in a number of cities across the United States that have tried this and then gone back to not allow it, it becomes very difficult for us to enforce. and we are focusing our primary law enforcement functions on the things that they have to do. We have some challenges, though they're not significant at this point, about maintaining our staffing and public safety. And so we are not at this point going to issue some sort of blanket guidance that says people can go out into the parking lanes. Many of those parking lanes are being used for pickup and delivery. And I would really just urge people, I know it's difficult, that we're going to have to do the best we can right now with our sidewalk spaces and our trails and other areas. And we'll examine that again in about a week. And I know the District of Columbia, the mayor was on the Kojo Namde show, I think today, and said the same thing, which is that at this point, we're not prepared to make those parking lanes available for social gathering because it presents a presents a whole series of issues that were similar issues that we've been facing in our parks. So I know that's not going to satisfy everybody, but that's where we are right now.
Thank you. There's a question about our ability to either require, and we know the case here, we know the answer to that question, but is there a role for us in working with grocery stores to ensure, and working with grocery stores, and other sellers of goods to ensure that there's an adequate supply of critical goods like masks, surgical gloves, disinfectants, and similarly, is there a way that we can prevent our community from hoarding these supplies when they are available at stores? So both the supply and demand side, there are questions as to whether Arlington can better allow for there to be these critical supplies available to people and not hoarded by a few. Mr. Schwartz, Mark Schwartz.
I'm gonna start there when it talks about critical supplies. I'm gonna make a shameless pitch here for people to go online and look at Chair Garvey's video that she did about how you can create face coverings. That it works really well. And we would do that. As far as supply chain issues with grocery stores, generally, I think that if you've gone grocery shopping recently, you'll notice that there are some products that simply aren't there. And the supply chain, we are told nationally, is strong, and we don't have concerns in the long run about those supplies. I'm going to pitch it over to Mr. Jim Schwartz to talk a little bit about the national availability when it comes to those kinds of gloves and masks and some of the issues we've been seeing, given the priority that has to be paid to our workers that are on the front lines. So, Jim?
So at this point, we would repeat the message that the N95 masks, the surgical masks that people are sometimes able to get their hands on, are a scarce resource that should be preserved for the healthcare community, for the first responder community. We have a pretty good stockpile here in Arlington. We have some access to some additional resources, but it is a fact that many in this region still lack adequate supplies to go beyond. In one case, we heard about a couple of days ago, a jurisdiction that's worried about getting beyond another week. So the masks that professionals would wear, we would ask the community to not try and acquire. And in fact, when we ran a donation opportunity last Friday at our public library, one of the things that our community came through with, people having N95s and other such masks in their basements, they donated them so that we could repurpose them for better use. We very much appreciate that. I do want to just real quickly take a moment to talk about gloves for a second, because people seem to think that gloves are a level of protection that enhances their safety. And it's important to note that if you wear a latex glove, a surgical glove, some kind of glove to provide a barrier between you and the virus on a surface or an object, it's still extremely important that you not touch your face while you're wearing that glove. Because if you have picked up the virus, if you have hit one of those droplets that we have referred to a number of times, even wearing the glove, touching your face can transfer that virus to your nose, your eyes, your mouth in a way that would then infect you. So the gloves can provide a false sense of security, and we would once again point people back to the most important aspect of avoiding the virus, which is to wash your hands frequently. When you can't wash your hands because you don't have access to soap and water, then use sanitizer. But don't fall into the trap of thinking that you are going to be overly protected by wearing gloves.
Thank you. So we have the need. You don't have a need to actually procure pre-made masks. You can do it yourself. We've seen Surgeon General Jerome Adams, Sanjay Gupta from CNN, but our very own local celebrity Libby Garvey show you how you can do it in under a minute with things that you have in your very own house. So that level of protection is something that everyone is encouraged to do. When it comes to other issues, there were questions about the availability of disinfectants in stores, and we've certainly seen those issues throughout stores. I saw some really terrific guidance, and I can't remember who it was from, but it talked about how we should approach these critical supplies when we do see them in stores. Only buy as much as you yourself or your family will need, and really no more, because as much as it may be comforting to get as much as you can, realize when you're dealing with a pandemic, if you have supplies in excess of what you need, it means that other people are likely not having what they need, and the general ability for the community to be safe is compromised. So you are in effect hurting yourself by hoarding, even though you may find some comfort in it. We have a number of other questions. We're going to try to get to these as quickly as possible. Just wonderful engagement from our community this afternoon. When it comes to Arlington Public Schools and school children, there are questions about whether or not Arlington can support K through second grade students like it seems some other Northern Virginia jurisdictions are. I can report that I have recently read that Arlington Public Schools is using their public education television channel to provide some resources specifically to students at the K through 2 level, Other students in APS do have devices that are provided by the school system, which has facilitated distance learning and engagement with their teachers. For the critical K through 2 students, they're going to be supplementing the work that teachers are doing on an individual basis with some resources available through television. Anyone else have anything they want to add on that? Okay. Mr. Tucker, we're going to move to you with businesses that are primarily summer businesses and what your thoughts are on the prospect for summer camps and childcare that also is focused on summer activities and initiatives. What are your thoughts about how they should be looking at the next 60 days and determining whether or not they're going to be able to provide services this summer?
I would encourage many of those businesses, summer camps, any other summer-related activity, to start looking at ways in which they can offer that service virtually. Should the need arise for them to do so. We can't really predict how long we'll continue to be in this socially distant format of living that we're currently in. So I would challenge those organizations right now to think about how they could offer their service either virtually or in a socially distant, compliant manner at this time.
Mr. Dorsey, if I could add something on that point. We're currently involved in some conversations with the Department of Parks and Recreation. And people in the community, I think they understand this. For us to stand up our summer programs, right now is actually our prime season to do that, where we're going about doing hiring and trying to find locations. And there is just a very big question mark as to whether we'll be able to make those arrangements. So I just wanted to echo what Mr. Tucker said. People should start thinking through alternatives for that. We haven't made a final decision, but at this point, I would characterize it as questionable as to whether we'll be able to carry those out.
Okay. Ms. Garvey, for you, what are your thoughts on what the board can do next? This is going to persist for renters far past April 26th. So do you have thoughts or ideas about what you would like to do in subsequent months to deal with the issue of evictions, potential evictions for people who may be renting units? And then there was another question about whether there could be private resources that would go into a county-sponsored fund to support people who are having difficulties paying rent during this time.
Thank you. On the second question, I believe, and I'll have Mr. Mark Schwartz verify, but I believe we're encouraging people to give to the Arlington Community Foundation for those kinds of gifts, because donations, because they have a little more flexibility in how to hand that out. So I think that's a good thing. On the question about how supporting renters, I mean, I think we're putting processes and supports in place right now. So the question is, how long do we continue it? And you will see in the budget that we're the very slimmed down budget that we're going to be talking about and approving at the end of this month. It includes a fair amount of money for needs to help support people. So I think that's really important going forward. The other thing is about the long time. You touched a little bit, Mr. Dorsey. I think it was great about our colleague Eric Gutschall and him stepping down, and that has put some strain on the board just emotionally, because we all care about Eric. He's a friend of ours, but that's writ small all across this community. People are experiencing loss of friends, sometimes in the normal course of life, or people having to step back. They're experiencing loss of maybe their favorite store, their favorite waitress that they used to like to talk to. There's a lot of that going on. So that gets into the whole kind of mental health issue for the whole community. We need to be resilient and strong in our emotions as well, and it does involve helping everybody. So I think we're going to keep up with these town halls. I had some concluding remarks, and I think Mr. Dorsey is all right. I'll kind of make them right here, and then I'll let you close up when you feel like we're ready with the questions.
Sure.
But we really we appreciate the feedback we got on this. We decided that the business community was a really important topic to touch on. Next week we're going to do food, and we'll have Abby Raphael here and feeding. And I just welcome people to send us some suggestions about how they like these town halls to happen. We are going to work on doing Open Door Mondays, ways of staying connected. Looking forward to topics. I've been putting down a few notes here. I think at some point maybe just mental and emotional health in the community would be a good topic, perhaps for one of our town halls. Also personal preparedness, which Mr. Schwartz has touched on, what people need to do to be thinking ahead, both on supplies, not too much, and thinking ahead to a summer, how it's going to be if your children don't have the usual kind of summer programs. Everybody needs to be kind of thinking ahead about that, and perhaps we could have a program on that as well. And then finally, just, and that's part of the mental health, I think, is the need for patience. In so many ways, it gets frustrating, I think, for people to go to a store and find that what they want isn't there once they've made the effort to get there, or something is not the way it used to be. And sometimes I think that our reaction to that can be additionally strong because of all of the different stresses and strains we're all under. So I urge everybody with patience on a lot of different levels, and urge us to continue to stay together, and look forward to feedback on these town halls or anything we can do to help support you. And we'd love to hear from people about that. So I think I wandered off the question. I'm sorry.
That's okay. That's
I hope
okay.
I kind of answered it, but I wanted to just kind of get that message in, because I know we're starting to run out of time, and just wanted to encourage people to stay in touch. Let us know what we can do for you and how we can do better, because we're all making this up as we go. Thank you.
And to specifically the person who is interested in their own private resources going to support others, the way you contact the Arlington Community Foundation is at www.arlcf.org. And Ms. Garvey, thank you for your closing message. And I'll ask everyone who has been on this town hall today if there are any key messages that they would like to convey to anyone participating this afternoon.
I'll jump in just for a quick second here, and just want to encourage people to make sure that, it's going to sound trite, and I know there's members of my families whose hands are raw, to make sure you wash your hands. That is the single most effective way. Wash them with soap, And you can look up the word saponification if you want to know why it works. To do that, when necessary, as often as you have to make sure that you keep the virus away from yourself, and to remember to be gentle with each other because we're going through some tough times.
Thank you. How about James Schwartz?
Thank you, Mr. Dorsey. I think that this would be a good time to just reinforce something that we touched on earlier, and that is, despite the most wonderful organizations that we have in this community, much of what we're likely going into is going to depend on how we're taking care of each other at an individual level. And I would just like to encourage people to start, if they haven't already, to begin checking on their neighbors, checking on the people that may be fine today, but may fall victim to this virus in the not too distant future and are going to need the help of somebody that's close by. It's not too early to start that right now, even if we haven't seen, a large number of cases in Arlington as yet.
Thank you. And our featured guest today, Mr. Telly Tucker.
Thank you, Mr. Dorsey. In parting words, I would encourage everyone to continue to support our local businesses. You are indirectly supporting keeping people employed during this time by supporting Arlington businesses. I would like to again plug our Biz Launch support local businesses page on the Arlington Economic Development website for the latest and greatest on resources, both at the federal, state, and local level.
Thank you. And as we conclude this afternoon's town hall, there were a number of questions that unfortunately we were not able to get to, but much of that information is available on Arlington's website, arlingtonva.us, and there is a very prominent place where you can click on information related to COVID-19, which has specific, detailed information that speak to a lot of concerns that people in our community have. One of the areas of questions we were not able to get to concern our fiscal year 21 budget. Again, there is information available on the website, arlingtonva.us. Type budget into the keyword, and that will give you the adjusted timelines for how our budget process will work during the month of April, as well as the revised proposal from the manager. We thank everyone for their participation, particularly the questions that stoked what I hope was an engaging discussion. Certainly thank Chair Garvey, both Mr. Schwartz's as well as Telly Tucker for spearheading the engagement with our community. And we'll be back again next week where our focus will be on food delivery systems, as well as ensuring that no one in our community goes hungry during these very challenging times. Ms. Garvey, is there anything else you'd like to say in closing?
No, I just thank everybody for coming, and just let people know next week it'll be our two other colleagues, Ms. Crystal and Mr. DeFranti, handling that town hall. And I'm going to look forward to tuning in myself and watching it from the other side. And again, everybody stay well, do the social distancing, use a face cover when you're out, wash your hands. We're all in this together, and we're going to get through it together. Thank you for everything you're doing.